Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and today's July 17, 2020 COVID-19 update. I want to thank you for joining and apologize for missing last week. We had a family death, and I want to say thank you to all our friends and family members in this community who've reached out to Angela and myself as we deal with the passing of her mother-in-law. But I want to say thank you to everybody for the prayers that were passed on to Angela, to her father. It was very meaningful to see the support from Northeast Texas while we were down in South Texas taking care of that unexpected family. So I want to thank you today. Look forward to talking to you. I already see that Stormy and Miss Martha Edwards is on. I want to thank Bobby D behind the control board, who's now giving me more capabilities to follow along as we're doing our updates and as we give lives throughout. So more to come, and we're excited that we're able to bring more technology and interface to Northeast Texas and Titus Regional Medical Center. Today I got a couple things I just want to give over last week and this week, some things I wanted to share that are going on at the health system that we're very excited about. Last week I want to congratulate, we are going to receive the Mission Lifeline Gold Award for our EMS team. Our ambulance unit at Titus Regional Medical Center is phenomenal. Mike Ultimate, Gary Short, and the paramedics and EMTs for Titus Regional Medical Center are top notch. They are independently owned by Titus Regional Medical Center, serve Titus County. What they've done over the last few years of bringing the standards on quality care has been phenomenal. So it's been exciting to watch them over the last few weeks. Some of you may ask why I'm wearing my mask today and may not be able to see my lips. Well, it's a prop, and you're going to see more of it today as we focus today on wearing our masks, the goods and the bad about wearing a mask and what it's going to do to help flatten the curve. But a shout out to Michael and his team and the EMS for what they've done and what they continue to do to bring fabulous care and emergent care to Titus County, Mount Pleasant, and Northeast Texas. Another exciting note this week, happy to announce today, just saw her a few minutes ago in her first time in the facility. Cynthia Gaddy will be joining us on Monday morning. She'll be our new Vice President of Critical Care. Cynthia brings years of experience in the ER, ICU, patient tower to Titus from all over the United States from places she's worked. So we're excited to have Cynthia join our team. You'll see some things over the next few weeks as we get a chance to show her off and partner with Kathy Griffiths on the clinical tower with our nurses and just show the phenomenal things they're doing, but also build on quality and patient safety at Titus Regional Medical Center. You're going to hear us focus on zero harm over the next year. As the quality and patient safety we go to improve for this area. It's going to be a great thing. And we're excited to have Cynthia join us, and she'll work great with the phenomenal nurses and doctors that we have here at Titus Regional. From a testing standpoint, let's get down to some of the things that I've seen this week. I want to give an update on testing. On Monday, we had the state work with the county and the city to offer another round of free testing. It was successful. It was great. We appreciate everyone who participated. Over 450 tests were given on Monday, and they ran out about end of the day. They were able to offer a new type of test, and it was a throat swab. We were excited to see that in the area, and as the state's offering more things, you'll start seeing that as the future down the road. They also were able to offer this time a quicker response. Not everybody has received the response, but I know quite a few people who were tested on Monday received the results Tuesday and Wednesday night. In the past, that's been 6 to 7 to 8 days. So we appreciate what the state and the county are doing. Judge Lee, thank you. Chief McCray, thank you for pushing those tests to this area as we continue to try and get more and more. As it comes to testing, with the increase in the state of Texas over the last 2 weeks and July 4th holiday, testing has been very difficult. The labs across the state of Texas are full. All of the resources that we have delayed our turnaround times from 24 hours and 48 hours to 5 days, 6 days. So it's made it very difficult. I would ask that the community remain patient as we continue to work through the increase in testing that's going on during this most recent surge. We are looking at some options to bring more testing here and different type of testing that will speed up that turnaround time. From a numbers perspective, just give you an update of where we're at. Community spread is here in Northeast Texas. We've seen it over the last 2 to 3 weeks. We've seen the increase in the ER. We've seen the increase in our patient tower. Wanted to have a broadcast last week just to let everybody know the numbers that we were receiving. We were able to get it and make it happen. But over the last 2 weeks, we've seen the highest testing and positives in this area since we were at our peak in the middle of May. We hit our peak in May. In June, we took a decrease, and we thought we were in the clear. Well, since July 1st, we've seen a steady increase here at Mount Pleasant and Titus County, and that increase is continuing. We saw today we have 1,146 positives cumulative to date for the hospital and the health system and the medical staff and the mobile testing, with approximately 425 pending results that are still out there. So I encourage you to focus on a few things. We're going to need your help to get through this. As I said, our ICU has been full for the last 2 weeks. We've run between 6 to 8 on a daily basis. Only 2 to 3 of those have been COVID on a daily basis in the ICU, but we continue to have our other normal high acuity patients, so it keeps that staff focused around 7 or 8 at full capacity, which makes it difficult and is a concerning for me, the physicians, and the administration and nursing staff at Titus Regional. So we need your help. Our COVID unit has remained between 5 and 6 all week. We hit a peak last week of 10 one day. Into shift, our highest was 9. But these are the highest numbers that we've had since we hit the 20 and 19 back in May, almost 60 days ago. So we ask for your help. Continue to wear your mask. Since the governor's orders last week about the mask came out, we've seen an increase of mask wearing by people in Mount Pleasant and Titus County and Northeast Texas. We appreciate that. We encourage you to wear your mask. I know it may be uncomfortable. I know it may be frustrating, but I can promise you, you are saving lives. You are making a difference. You are mitigating the spread when you wear this mask. I wear this mask everywhere. I started the meeting today, the Facebook Live with my mask on to prove the point. I'm using it in my office anytime I'm around somebody else within 6 foot. So I encourage you to encourage your family, your friends, the importance of wearing your mask. Also remember to sanitize. Use the hand sanitizer in the restaurants, grocery stores, the health system, wherever you are. Use that sanitizer as much as possible, and social distance. These 3 things have been consistent for the last 120 to 150 days, and I encourage you to stay diligent with each one of these. We need your help. This is not going to end this week. It's not going to end next week. We're in it for the long haul. We're changing our norms, and I would encourage you and plead to continue to wear your mask, sanitize, and we're looking for your help. It's been a long week, and you can probably tell if you've been in the hospital, if you have friends who work at the health system, if you have friends that are nurses or doctors at Titus Regional, or in any of the health systems in Northeast Texas. Last week, we saw the counties around us for the first time double their cases further south. Tyler, the Longview areas, the numbers doubled over the last week. So we're seeing it in this area. It's more difficult to transfer out. It's more difficult to get additional PPE or other resources when we get to the limits that we have. You're seeing the stress across our doctors and nurses. I want to say thank you. Thank you to the family members who support our nurses, the family members who support our doctors, and I want to personally say thank you to every clinical person and staff member at Titus Regional Medical Center and all the physicians who practice here and support our health system for the work you're doing. There's a lot of things I read on the media on a daily basis and on the news, but I can promise you that the work that's being done within this health system is phenomenal. The dedication by the staff, they're being selfless, and I truly appreciate. So from the bottom of my heart, our board of directors and administration, to our team members, thank you. To the community members, thank you for helping support us, your continued praises, your emails, your prayers, your text. We appreciate every one of those. We appreciate the handwritten notes. We appreciate people dropping off desserts. We appreciate people dropping off food. I cannot tell you in words how much it means to the staff, our doctors, and to us when we see those things. So thank you. We appreciate your support. We will continue to get through this. Thank you for your prayers. God bless. Have a great day.